recent INICET May 2025 Obstetrics Gynecology questions recall. The first question is according to MTP Act. Like according to MTP Act 2023, the opinions of two doctor is needed for MTP at what period of gestation? Because you know, if there will be the answer basically is very simple. If you there will be a less than 20 weeks gestational age. If you divide the gestational age, if it is less than 20 weeks, then there will be one doctor's opinion is needed. And if there will be the gestational age, very simple, if it is 20 to 24 weeks, then there will be a two doctors opinion is required. Okay, so answer will be two doctors is needed between 20 to 24 weeks. The second question is the minimum age for MTP. The minimum age for MTP is 16 year, 18 year, or 22 or 24 years. All of you know there is no lower limit of like to get MTP done. But usually if you cross 18 years, if you cross 18 years, because 18 year is you have to voluntarily give consent for anything. So voluntary consent can be given because she will be the legal guardian. So woman is legal guardian of herself. So basically if there is no mention, so 18 years is the answer of this choice. Okay. The third questions of this OBG recalls is according to modified rotatum criteria, which are the following criteria is for the PCOS. You know the modified rotatum criteria, the hirsutism, delayed menstruation, these are the two criteria. Obesity is not included in the criteria, and insulin resistance also not included in the criteria. You know there is a three possibility, that is hyperandrogenism, biochemicals, that is answer is that is the three is hirsutism and irregular cycles or delayed menstruations and the ovarian volume. Okay, ovarian volumes is more than 10 cc or any two out of three criteria, ovarian more than 2 cc, or antral follicle count, number of antral follicle count is more than 20 follicle number for ovary. This is the criteria. This is the rotoderm criteria. So modified rotoderm basically telling this, there will be a biochemical hyperandrogenism, hirsutism and irregular cycles, and ovarian volume should be more than 10 cc, and if you calculate the volume more than 10 cc, and the number of follicles is either more than 12 number of follicles, or if you cross sections 20 follicle number for ovary is the answers. So here obesity is not included in that criteria, but obesity usually is associated with the PCOS and insulin resistance usually associated, so don't confuse. So answer will be 2 and 3. So here is the option is C. The next question, so which of the following does not cause fetal bradycardia? The question is which doesn't cause. So actually usually in the abruptions of the placenta, in abruptions case, there will be a early there will be a pathological CTG. You get pathological CTG because there will be a sudden abruption will cause sudden fetal bradycardia. So this is the cause, because you know there will be a sudden separation of the placenta, from the surface. So there will be a sudden cut off of the blood from the fetus to maternal. So there will be a fetal bradycardia. And the second is fetal head compression. You always know there will be a deceleration, early deceleration because of head compression during the second stage of labor. Early deceleration will be there. So that will be a not the case. Then meconium aspiration syndrome. If the baby is in the disc stage, there will be some chances of decelerations or fetal bradycardia also happen. But usually the maternal fever, if the maternal pulse rate is increase, because you know every 10 beats pulse rates increase, there will be a fever also, that will cause fetal tachycardia also, that will not cause fetal bradycardia. So answer will be D.